Good afternoon. Welcome to the second meeting of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs. Ms. Weitzel, please call roll.
Senator Cruz Crawford.
Present.
Senator Dondero Loop.
Present.
Senator Rogish.
Here.
Assemblymember Dickman. Assemblymember Edgeworth. Assemblymember Hunt. Assemblymember Karras.
Present.
Chair De Silva.
Present. Okay, Ms. Weitzel, I believe we have Assemblymember Patchett who's taking the place of Assemblymember Dickman. So can we mark him present?
Present.
There we go. Okay, everyone is present. Madam Secretary, please indicate all committee members are present. Okay, so before we begin, I would like to go over a few housekeeping items. First, I would like to remind everyone to please silence all your electronic devices, especially cell phones and laptops, during the meeting. This committee will meet 4 times during the interim, and Las Vegas will serve as our primary meeting location with video conferencing to Carson City. Members and presenters may also attend virtually via Zoom. Everyone is encouraged to participate from whichever location is most convenient. The committee's meeting materials can be found on the committee's webpage located on the Nevada Legislature's website. You can also sign up for electronic notifications related to any activity on the committee's website. If you wish to testify in person, please sign in at the table by the door and leave a business card. If you do not testify, you may also want to sign in so there is a record of who is interested in a particular topic, and in the event the committee needs to contact you later. When testifying in person, please turn the microphone on, speak directly into the microphone, and turn the microphone off when you are done speaking. We have listeners and viewers in Carson City and online. The meeting is being recorded and is available on the legislature's website. We will have a public comment period at the beginning and end of the meeting. Public comment is limited to 2 minutes per speaker. In addition to testifying in person, members of the public may provide public comment in 4 different ways, all of which are listed on the agenda. You can provide public comment by calling 888-475-4499, then entering the meeting ID, which is 897-8902-6425, and then press pound. Emailing comments to the committee's email address and mailing written comments. You can find the phone numbers, email address, and mailing address on the agenda. With that, let's get started. So we'll start with we'll now go to agenda item 2, which is public comment. We will start with public comment from those in the physical locations and then move to public comment from anyone who has called in. Is there anyone in Las Vegas who would like to provide a public comment at this time? Okay, seeing none here in Las Vegas. Is there anyone in Carson City who would like to provide public comment at this time?
Good afternoon, Mr. Chairman and members of the committee. My name is Donna Klontz. I live in Reno, Nevada. I'm a member of the Executive Council for AARP Nevada and serve with other volunteers up here in Northern Nevada, carrying out programs for Northern Nevada seniors in the community. I know AARP is on the agenda today, and I commend the committee for all of the topics that you have before you today, including all of the issues that we have in our state for seniors, including food insecurity, which is toward the end of your agenda, in which I looked at the stats there, and more often than not, the same number of children that go hungry in the state of Nevada, the same number go hungry as seniors as well. It's on both sides of the spectrum, and it's a terrible thing to be hungry in our country today. And so finding some ways to support that issue for our state is something that is vitally important to the lives and the health of seniors. So I wanted to say that one first. Also, you're also going to be hearing from ADSD today about the waivers and the fact that because of financial issues that we've got huge wait lists again for our seniors in the home and community-based services and in the frail elderly waiver that cause some of those seniors to stay on that list to the point where they have run out of every resource they have and basically die on the list, literally. And I hope that we can avoid that this year. Several years ago, we were able to eliminate those lists, and so I'm urging our state, as we get to that point in the budget, to really take a look at how ADSD can be helped in their budget to eliminate those waivers that are for the most seriously in need seniors. Last of all, I'll use the last few seconds for our AARP presentation that's later today. We really appreciate the time that you're giving to Jessica Padron from our AARP staff to talk to you about fraud and the related issues, especially looking at the numbers of how many of us there are in the state of Nevada that can use many of the services that the state provides. There are some really good recommendations for legislation toward the midst of her presentation. I won't go into those now, but I urge you all to take a really good look at that. I know that there are model legislative forms that you can find from many other states that have already gone through the process to create some more protections for our seniors. And our state is 5th in the country for seniors being taken advantage of and losing most of their funds, if not all of their funds, to scam artists. And last of all, I know Jessica's going to talk to you about crypto kiosks, ATMs, and that whole problem these days. And that is one that I think is a main topic that she'll be hitting today. So I wanted to tell you that all of us who are here in our state are very interested in having our legislature take a look at some statutes that could help protect more seniors in that way. Thanks again for your time.
Thank you. Is there anyone else up there in Carson City for public comment?
Good afternoon, Mr. Chairman and fellow committee members. My name is Barbara Devers, and I come here to talk about a couple of items. Number one is food preservation. I have the good fortune of actually volunteering my time at one of the food pantries in Reno, where I'm a resident, and it's for both the senior population and families. And it's kind of heart-wrenching to see the fact that we don't have that many through ours. We have between 30 and 35 that come through every 2 weeks. But it's like they have to go to ours and then a couple other places just to get food in order to, have decent food to eat. They're always so grateful. So anything that you can do to intensify that, it would be greatly appreciated, I'm sure. And the other comment I was going to make is I had the good fortune of working for the state of Nevada for 34 years. I retired 18 years ago. Most of my time, at least 25 years of it, was working with the elderly, and I took part of I was running the homemaker program, which is non-existent now. But in that capacity, I had the chance to deal with the social workers that had to do the waivers. And at one time, like Donna has stated, they had well over a couple hundred on the waivers, on the wait list. We've tried for a number of years to get that down. Eventually, several years ago, it was able to be done, but now because of the population increase in Nevada, we find ourselves again in the same boat. So if there's anything that the state can do to intensify and increase the funding, that is actually the last resort for these people that have no other way to take care of themselves. And thank you very much.
Aging. I'm also volunteer with AARP for many years. My center is a 501c3 nonprofit organization dedicated to improving the quality of life for older adults by developing innovative, community-based solutions that support independence, safety, and well-being. Through our programs, we are developing a Northern Nevada home sharing program. We seek to connect older adults who have available housing with carefully screened individuals seeking affordable living arrangements, creating mutually beneficial partnerships that reduce isolation, increase housing stability, and enhance daily support. By leveraging public, private, and philanthropic resources, the program will provide home sharing, education, participant screening and matching, and ongoing support services to enhance safety, sustainable home sharing relationships while demonstrating a cost-effective model that can be replicated in communities. We are dedicated to adding life to years. My second statement I wanted to make is on caregiving. Several years ago, I did a caregiving study of Washoe County employees and found many that had caregiving responsibilities spent time on the phone trying to deal with it while they were working. We found that it cost the county about $1 million a year in lost productivity. I encourage the state to develop more support for people, particularly working caregivers, to help them deal with those issues. And we want to add life to years. Thank you.
Thank you. Okay, seeing no more in Carson City, our AVH staff will interact with those calling in to make public comment to facilitate participation in the meeting. AVH, please add the first caller with public comment to the meeting.
If you'd like to participate in public comment, please press star 9 or raise hand in the Zoom window to take your place in the queue.
Hi there, can you hear me? My name's Stacy Dubowich.
Yes, please continue.
Okay, great. Thank you. Thank you for allowing me this time. I first would like to thank the committee for inviting the Alzheimer's Association to speak. I am a volunteer with the Alzheimer's Association for many, many years, and I've had the opportunity to talk with many advocates in other states. And there will be an action agenda item later on where they will be speaking about a dementia coordinator specialist position. And I just wanted to discuss real quick that this has helped other states to accelerate their progress on the Alzheimer's state plan. I am a state-appointed position to our task force Alzheimer's disease, and there's still a lot more work that needs to be done, and this position would be necessary to help move that forward. I also would like to just share briefly that I work with another local nonprofit called Senior Resource Nevada, where we help seniors at the intersection of housing and healthcare and work very closely with the home community-based waiver through Medicaid, and that has been an issue going forward as some of the other people have mentioned. I've worked in this industry in this capacity with senior living for nearly 20 years and seeing the gaps in healthcare. Not only is this necessary, but especially here in the state of Nevada, as we are the fastest growing state for older adults. Every day we have over 10,000 people turning 65, and more people are coming to Nevada, and we do not have an infrastructure in place to support that. So I appreciate you listening to me real quickly, but you'll hear more about the action item from the Alzheimer's Association regarding the dementia coordinator specialist and how imperative it is that we have it here in our state. Thank you.
Good afternoon, Chairman De Silva and committee members. I'm Connie McMullen, a volunteer for AARP Nevada. AARP Nevada representatives will be making a lot of good recommendations today to guard against senior financial exploitation and abuse. The need to protect elders against the many scams and fraudulent means of duping them out of their life savings is often too great, and the skills at which the crimes are perpetrated are very clever. Nevada should seek to provide a safe harbor for this growing population whenever good policy and appropriate tools are presented, like they will be today. I also would like to speak to item 7, home and community-based services. These are the programs that keep our elders aging in their place and to avoid premature institutionalization. These programs need to be fully funded and the wait list eliminated for this frail and fragile group of people. I have done 3 strategic plans for the state dating back to former Governor Gwynn in 2000. And in all of the strategic plans that I've ever participated on, home and community-based services has never been fully and adequately funded for caseload growth. I thank you very much for your service and commitment to these very serious issues.
Chair, there are no more callers in public comment at this time.
Thank you, Broadcast. There will be another public comment period at the end of the meeting, or you can submit a written statement which will be added to the record. Please submit your written statement no later than 48 hours after the meeting. And with that said, we'll move on to our presentations to agenda item 3, which will be a presentation on employment, age discrimination, and policies to support a multi-generational workforce. Our presenter will be Glenn Jacoby from the policy associate with the National Conference of State Legislatures. To start off today, we have Mr. Jacoby, Glenn Jacoby virtually.
Yes, hello. I'm going to share my screen really quickly so that we can get the slides going here. All right, are you guys seeing a slide that says reemployment after retirement?
Yes, we can see it here.
Great, thank you so much. Okay, wonderful. So yes, hi, thank you so much, Chairman Silva and fellow members of the committee for having me today. My name is Glenn Jacoby. I am a policy associate with the National Conference of State Legislatures. If you are unfamiliar with NCSL, we are a bipartisan membership and professional development organization for both state legislators and legislative staff. And we serve all 50 states as well as the territories. And essentially what we do is we work to provide nonpartisan research, testimony, and technical assistance to the states as they go about their legislative work to support the legislative institution. The policy areas that I personally cover, should you ever need to reach out to me at NCSL, are employment opportunities in the state for people with disabilities, as well as paid leave, harassment and discrimination, yes, so those are the ones that I generally cover. My colleague, Angie Rowe, is usually the one who covers issues related to retirement and pensions. So anything that I'm not able to answer today, if you have questions, she helped me with this information, but she will be happy to, fill in any gaps that are in my knowledge, and I can communicate any questions that you all have to her after the fact. So with that said, I'm going to jump into this graph. So in September of 2024, the U.S. Department of Labor released projections for the workforce broken down by age as a percent distribution of the labor force up through the year of 2034. And the main thing that I want you to take away from this is look at the column on the far left in comparison to the column on the far right. So on the left, we have up at the top this skinny amount of 65 and older, this tiny little sliver at 3.4%. That was in 2004. If we go 20 years after that, to a couple years ago, to 2024, that has more than doubled. And that growth is projected to continue into 2034 and beyond. This group of workers who are 65 and older is the fastest growing group of workers in the country. And so that has really major implications for what our workforce looks like and how we support those workers who are older. And it also begs the question, why is this happening? What are the forces that are driving it? And it's a few different things in play. One of them is just the fact that we are living much longer than we used to. The average US lifespan right now is just under 79 years old and continuing to grow. So we have more working years than we used to have. But also a lot of workers are maybe retiring and realizing that retirement isn't what they thought it would be, or they have different reasons for why they might want to return to the workforce. And so we're going to get into a few of those. So in this presentation, I'm going to call re-entering the workforce after retirement unretirement. It sounds a little casual, but it is the term that is usually used, and it's also less of a mouthful. And so people unretire for a lot of different reasons. But the main one that the majority of people who have retired and then unretired cite is financial necessity. Almost half of folks who come out of retirement do so because they either currently can't pay their bills or they are concerned about being able to do so down the line. This has increased as inflation has become more and more of an issue. There are also, though, reasons that are not financial reasons that are cited almost as frequently when workers are surveyed. And one of those is just the emotional and social benefits of being part of the workforce. You know, work gives us a lot of meaning, it gives us a lot of structure, a lot of social interaction. And so a lot of folks might retire and realize that they miss those things and they, you know, want to pick up some sort of work, either part-time or full-time once again. And then other reasons include workforce shortages. So we're going to get into this one a little bit more because this is one that the state often sort of uses its levers to help address. But workforce shortages often can inspire folks to re-enter the workforce if they had worked in a sector that is currently experiencing a lot of shortages. I also want to highlight there's a really interesting sort of gender split when retirees who have then returned to work are polled and asked about their primary reasons for doing so. Usually the financial motivation typically comes from either women or single retirees. They are much more likely to cite income as their primary motivator for returning to work. Whereas men are more likely to cite the social connection piece that we sort of talked about as their primary motivator. And so these are, you know, just helpful things to keep in mind when we are considering the myriad benefits that can come with people, you know, wanting to return to the workforce. I also just did want to highlight that the increase in age for full Social Security benefits, you know, that went up from 65 to 67. And so that has also contributed to this unretirement trend. And so when people make the decision to unretire, it can sometimes have major financial consequences for them that they might not have necessarily anticipated. And this most often comes in the form of pensions and the ways that their pensions can be impacted. So historically, reemployment can cause pension benefits to be frozen for workers that decide to come out of retirement. A lot of states restrict the number of hours that a person can work while they still collect pension benefits. And many will also limit the actual earnings amount that they can make without disruption of benefits. And so oftentimes regulations for state retirement covered employers are very strict and require, as well as these limits, they also require a gap in service or a break in service to avoid frozen benefits. So, you know, if you're a teacher, you might have to be out of the workforce for a year before you could re-enter without some sort of penalty when it comes to your pension. So states are starting to recognize, or have in the last few years begun to recognize, that these are issues and impediments for folks who are older workers who might want to unretire. Especially when you look at the stats of this, by late 2024, 20 to 25% of retirees wanted to get back into the workforce in some capacity, even if just part-time. And then another 7% of them were looking for work. And so, when we have this big shift, states are realizing that we have to make adjustments to pension legislation. And so when it comes to pension legislation, unretirement legislation is what we usually see the most of, both in terms of what is introduced as well as enacted. Most bills on this front, including this current session, focus on adjusting existing pension provisions. So they might focus on increasing earnings caps or increasing hours limitations for the amount of money that you could earn or the number of hours that you could work and still receive your pension benefits. They also might modify the separation from service rules. So in that example earlier where, a teacher, say, needs to be out of the workforce for a year before they could work again, maybe we cut that to 6 months or even 3 months, depending on circumstance. And then also just allowing reemployment in and of itself without suspension of pension benefits. That is something that some states still needed to do. I also just wanted to highlight, oftentimes unretirement legislation will be specifically focused on teachers, law enforcement officers, public safety professionals, basically people who have worked in sectors that have high turnover and also high risk and are increasingly subject to workforce shortages, not only because of the nature of those sectors, but also just the changing demographics of the workforce itself. So this legislation can also include time limits to be built in. So it doesn't necessarily have to mean, a permanent change. Oftentimes there's like a sunset provision built in that can then be revisited later, or they can be targeted towards rural or underserved communities that are more impacted by these shortages. So if you're trying to sort of strike that balance between, budgetary concerns when it comes to pensions, you can sort of have a targeted approach in terms of, trying to adjust for that. So I also just wanted to highlight a few pieces of legislation that are sort of good examples of what we discussed that were all enacted last year. And you can feel free to, look into these on your own time if you're interested, but just a few examples. Montana last year enacted House Bill 349. This allowed retired teachers to work for up to 5 years without incurring any sort of interruption of their pension benefits. Delaware has enacted legislation that broadened unretirement provisions to let substitute teachers return to work after a 3-month rather than a 6-month break in service, and then also completely eliminated the $50,000 a year earning cap. Rhode Island last year allowed retired teachers to work up to 180 days rather than the previously allowed 90, but only in targeted areas that are deemed by the state to have a specialized need for teachers in that area that are experiencing workforce shortages. And then lastly, Washington State last year passed a bill extending a provision that they had created a few years ago. So it seems like it's going well for them. It was House Bill 1936, and it extended provisions that allowed teachers to reenter the workforce while still collecting their pension. So a lot of these I know were teacher focused, but these can have implications for any number of different workforce sectors. So with that, I know that was a very high level overview, but if there are any questions on these topics, I'm happy to answer them, or if I cannot, I'm happy to pass them along to my colleagues who would certainly be able to do so.
Thank you. Committee members, are there any questions? Okay, I have one quick question. So you mentioned earlier in your presentation about the reasons why men and women re-enter the workforce, unretire, I think is the official academic phrase. So there is a disparity there in regards to why they're entering, with a sense of a fiscal reasons why women are re-entering the workforce, and social and emotional reasons as to why men are unretiring. Is there any information or any sort of research as to why that may be? Is there a disparity when it comes to women in regards to the income that they're earning into the households, or there may be other tangential factors there? Can you just expound upon that a little bit? Thank you.
Sure, yeah. I can't speak specifically. I would bet that there is quite a body of research on it. I can't speak specifically to those, and I don't want to give you any like misinformation. But I would be happy to ask Angie because she has, cited that research to me before, and so she probably would be able to explain it in a little bit better detail as to some of the contributing factors there. But I don't know them off the top of my head, to be honest with you. But it is a very interesting question. I actually didn't know that until I was like preparing this presentation, and I was also curious. So I'm happy to look into that, and then I can send some info Destiny's way.
Awesome. Thank you so much. Committee members, any questions? What's the questions? Okay. Thank you. Thank you for your presentation. We'll move on to our next agenda item, which will be a presentation from the Alzheimer's Association. I believe you have representatives from the Alzheimer's Association here to conduct the presentation. Awesome. You may begin when you're ready.
Thank you, Mr. Chair and members. Let's see. Would I have it loaded here, Destiny? Apologies. Thank you for the moment to figure this out. Mr. Chair and members, we're working to get the presentation loaded, but in the meantime, is it okay if I just introduce myself and start the conversation?
Yes, yes, please. And again, I do apologize for the technical difficulty, but yes, please proceed.
Thank you so much. Mr. Chair and members of the committee, for the record, my name is Tori Roberg. I am the Director of Government Affairs for the Southwest and Mountain Territory for the Alzheimer's Association. And I just want to thank you so much for the opportunity to present to you today about Alzheimer's and dementia. The first thing I wanted to bring to your attention is the reason why I'm here. So I have been a public policy professional for 21 years. And several years ago in 2021, my mom was diagnosed with Alzheimer's. Actually, it was mild cognitive impairment. And like most families, we didn't get a whole lot of information. We didn't know what was going on. And I actually took an entire year off to take care of my mom and help my dad. And in that year, she was diagnosed with dementia. Our first question was, what kind of dementia? And the answer was, well, we just don't know. And so I've really experienced a lot of the ups and downs of this disease. My mom went fast. Unfortunately, she was only 15 months into the disease when she died. Well, when I came back to the workforce after taking that year off to take care of her, which, by the way, was one of the best decisions of my life, I decided that I wanted to change my career from what I was doing previously in public affairs and advocacy and work solely for the Alzheimer's Association. And this is my full-time job. I've been doing this for 3.5 years, and I have really had such an opportunity to meet people along the way who have also been impacted by the disease. And having been through it myself and being a public affairs professional, I feel that this is just such a great opportunity for me. So I just want to thank you again for having me here to advocate for people living with dementia in Nevada. And we're about to get into the numbers. Here we go. Thank you. And I just want to thank the staff. Thank you for helping. Thank you, Destiny. This is my mom. This was the slide about my mom. This was taken 3 days before she died. But I already told you the story. So let me tell you a little bit about the Alzheimer's Association. If you're not familiar with us, we are the world's largest nonprofit funder of research in Alzheimer's, and that's in the world. The number 1 and 2 spots are the United States government and the Chinese government. We are the number 1 nonprofit, and the reason why is because we feel that there is a world without Alzheimer's and other dementia. And 3.5 years ago, when I started here, when my mom was going through the disease, there was no hope, and we were working very hard. And I'm glad to tell you that I have some great updates for you today on where we are at. Because, one second, where was it? Here we go. Here's our impacts. So we offer programs and services all across the United States. Again, we're a global funder of research, and here in the United States, we provide care and support. We are highly invested in research at both a national level. The NIH, we advocate for funding every year for an increase. And our advocates share their stories. That's how we reach you. So I'm curious of the folks here in the room, how many of you have been impacted by Alzheimer's or another dementia? If you have, please know we have a 24/7 helpline. Thank you. We have a 24/7 helpline. I called this helpline 3 times while my mom was going through the disease, and I worked for the Alzheimer's Association. Our helpline is a lifeline for families. We answer the phone. We have, there's a translator service, so I don't think there's any language that we can't translate. We're here to provide help to our families. Additionally, we provide free education and support in the community. So we have a lot of information online. I will say, interestingly enough, I was at a trivia night with my friends, and there was someone advertising some Alzheimer's information, and it was a seminar, and they were charging people like $3,000. I'm not joking. Like, it was kind of ridiculous because all the information they were providing was available for free on our website. So I just want to put that out there for anyone looking for free information. We got you. We're also always, we have a trial match program. So the only way we can move our research forward is by having people participate in trials. So if you have a family member or not, if you have the disease or not, there is probably a trial for you. There's a lot of research happening in Alzheimer's right now. And we would love to have you and your constituents join us. So look for our trial match. We have 2 offices located in Nevada, one in Las Vegas and one in Reno. Through those offices, we provide direct services to families. We're a resource. We do caregiver support groups, dementia training, education classes, and we have some respite for families too. So anyone looking for help, again, should call our 24/7 helpline and you'll be connected with our local staff as well. But first, I'd like to go into what is Alzheimer's, if you're not familiar with it. Alzheimer's, what's the difference between Alzheimer's and dementia? I get that question all the time. And in fact, isn't that what I asked my doctor with my mom? I said, what kind of dementia does she have? I'll tell you, the only reason I knew to ask that question was because I actually Googled dementia. I found the Alzheimer's Association website before I even worked here and learned of all the different kinds. Alzheimer's is actually the most common form of dementia, with about 3/4 of all cases. And age is the greatest known risk factor, but it does occur in people under the age of 65, and it's more common than you think to be in your 40s, 50s, or 60s and get this diagnosis of dementia. These are different kinds of dementia. We have Alzheimer's dementia, there's vascular dementia. This comes up all the time. And maybe it's because I work in this field or not, but my friends, it's so interesting to me. Yesterday, I actually had a friend talk to me about her mother-in-law's care in a group home. And she says, most people don't even understand what's going on. I said, oh, I get it. What's going on? I understand dementia. Turns out her mother-in-law had a stroke and had a form of vascular dementia. And so now she's living in a group home, unable to take care of herself. And my friend was telling me all the things we know about caregivers, that they're stressed, even when someone has a place to live where they're being cared for. The stress levels are still high. So we know that caregivers go through a lot. A lot of people want to know what the 10 warning signs are. So if you are like me and maybe somebody going through some hormonal changes in your perimenopause, that is not dementia. We have some brain fog. Don't worry, you don't have dementia. But we're looking at things like what's memory loss that disrupts your everyday life. So think, you put your car keys in the refrigerator because you think that's where they go. That's dementia. If you've forgotten where you've placed your car keys because you just set them down somewhere, no, that's not dementia. That's just being forgetful or maybe brain fog. But if you are experiencing any of these symptoms or anyone watching, we encourage you to talk to a medical professional to have to be evaluated in that way. So while there's still no cure for Alzheimer's, there are actually some treatments in the last couple of years, FDA approved, that have been shown to slow the progression of the disease. And this is important because you have to find it early. You can't just, it's not reversible. We can't reverse Alzheimer's or dementia, but we do have hope, right? So I work with a lot of families in the early stages of the disease, and some folks are under the age of 60. We're talking 58 years old, early retirement, right? So when people are on some of these new treatments, it can actually slow the progression so much that it gets them to hopefully the next treatment. And I actually have a gentleman I've been working with who has testified he's been on the treatment since it was in a trial. So remember, we talked about trials. He was diagnosed at age 58. Now he's 63, And he did have to retire from work, but his disease hasn't progressed very much at all, in the sense that he can still drive, he can still manage his everyday affairs. And that's pretty spectacular, if you ask me. So we're getting the word out that there's treatments available. There's still a lot of public policy discussion of how do we get to those treatments? How do we ensure that people have access to it? How can they afford it? We know Medicare covers it, but what about private insurance for people under the age of 65? These are a lot of the questions that are coming up that the Alzheimer's Association is actively working to solve. Why? Because Alzheimer's is on the rise. So last year we hit the 7 million mark, and not in a good way. It's not like we're McDonald's with French fries. No, these are over 7 million Americans living with Alzheimer's. And we know that it's a leading cause of death. In most states, it's in the top 10. And it kills more than breast cancer and prostate cancer combined. I mean, it is something that most people don't consider a killer, but it actually is. You think it's just your memory going, but there's a lot involved with dementia, including blocking neural pathways, so that maybe your brain doesn't talk to your heart the way it's supposed to, and this is why people can fall. Maybe your brain's not talking to your muscles, and your body's not working right. That's dementia. It's not just about your memories. And in fact, some people can live their entire life with dementia and die from it and still have all of their memories. So it's actually it can actually kill you, and it is very high on that list. I'm going to skip the video. Okay, so here's for Nevada. So the numbers I showed you previously were national. So we're looking at 54,900 Nevadans living with Alzheimer's. That number's probably increased because that's from 2020. 10.6% of all Nevadans over the age of 65 are living with Alzheimer's. And in 2024, 87,000 family caregivers provided 146 million hours of unpaid care. So these are like friends and family, people who do not get paid to care for their loved ones. And that care is valued at $3 billion. So unpaid caregivers, friends and family are saving the state a lot of money. We know that Nevada is not ready for what we have now, much less what's coming. And so we're looking at a geriatrician shortage. There were 16,000 home healthcare aides in Nevada, but that number needs to increase 33%. How are we going to get there? These are a lot of the public policy and systems decisions that you can be considering this year and in future sessions. We know this is a very expensive disease. So $300 million in Medicaid costs in 2025. That's significant. That's long-term care. This is the Medicaid cost of long-term care. It is an expensive disease for the state. And so if we can get to the point, just bear with me here, follow how we're thinking. If we can get to the point where we can get enough people diagnosed early, they get the right care, right? And they get maybe a treatment, or the treatments progress, and we can slow that gap, so that maybe people won't need long-term care. We won't have as many people needing long-term care, and that's how we can help our state budgets. And it's hard to see, but I'll tell you, 3 years ago it was harder when none of these treatments existed. So I can see it. I hope you can too. We also know that dementia patients are more likely to come back to the hospital within 30 days. And these are people over the age of 65. This was pulled using Medicare data. So they're comparing them to people on Medicare who don't have dementia. You have dementia, you're more likely to come back within 30 days to the hospital. Think about that. So we're trying to slow the progression of the disease. Our vision is to end it. We'll get there. But this is how we do it. So I was asked today to provide you with some numbers, and also some of the things we're working on at the Alzheimer's Association in our policy team. So I'm going to start with some of our federal priorities. I've highlighted two of them for you, and these are what we're asking the U.S. Congress. So the first one is the ASAP Act. this one, and you'll see a familiar face on there. Your Senator Kathy Cortez Masto is one of the prime co-sponsors of this legislation. It is completely bipartisan. There's Republicans and Democrats working on this. So what the ASAP Act will do is it basically takes this blood biomarker test, which is one of our new, it was just approved last year. So this is hot off the presses. The FDA approved a bio-blood marker test to help clinicians diagnose Alzheimer's and dementia sooner. It's not the end all be all, but it is a great start. So what this one does is it clears the way for folks to have this test. I'm going to move on to the next one, which is we call it the ADAPT Act. So we don't have a Senate sponsor yet, but we do have a House sponsor. And this bipartisan act, it basically gives clinicians the tools that they need to diagnose earlier. So you can see we're focusing in on this. Let's get people diagnosed early. Let's get them diagnosed accurately. We want primary care physicians to better understand this disease. We want them to understand the early warning signs. And not only that, but if through these, I think this is through the telementoring program, what we're doing is we're trying to change the entire healthcare system. We're trying to change the whole system. So, you know, we could talk about primary care physicians, but there's also the nurses, the social workers, even the person who is making the appointments to have a better understanding of what dementia might look like and when to notify someone, hey, I think that we want to make sure that this person receives a cognitive exam, right? Because it's going to take a clinician to always make that diagnosis. But what we're finding is that in states that have done this individually, that whole healthcare systems are changing. And we're looking to do this on a national level. So that's a federal priority. Talking about state policy priorities. So we're looking at the Nevada Legislature, and that's obviously what you've invited us here today. So I'm going to share with you a little bit about what we do on a national level with our policy priorities, and each state has an individualized plan. So these are our 5 current policy priorities that we focus on at the Alzheimer's Association, our policy team. These are what we're looking for states to do. I'm going to go through them one by one for you. So when we look at advancing risk reduction, we know that there is greater awareness of when there's greater awareness of the risk factors and the warning signs for cognitive impairment, then we can actually diagnose it earlier. So we're looking for ways to improve local, the state's capacity to make sure that your health systems are ready. So we're looking at that, different ways to do that. We're looking at enhancing care and support. So this goes, we talked about the healthcare, which also includes like planning, care planning, and access to services. And then we're looking at, in this one too, is care and support. So we're talking about how do we support those caregivers who are giving their time. And, you know, we have it's very common in our field to say, if you've never experienced a person living with dementia, then it's hard to really understand what it's like. But if you have, you know, it's hard. You're thinking about your loved one, even if you're not with them. So what we're looking to do is give folks breaks. We also know caregivers have higher levels of stress. We need their caregivers to be ready and able to take care of them. So we look at different ways for that. Next, we ensuring access to diagnostics and treatment. Again, we're looking at how can we improve these systems. Supporting quality care. Now, this is really interesting too. What does quality care mean, right? So we talked about caregivers, but then there's also licensing. You have your state agencies that do the licensing of your long-term care communities. Who's licensing the caregivers? What's the training like? What is the training like for your EMTs and your police and your emergency services? There's a whole gamut of areas where we can be better prepared to meet the needs of people living with dementia. And the last one is on building a state government infrastructure. And I'm here today to ask you to help. Right now, Nevada is one of the only states in the, we have 32 other states that are currently working on they have a dementia services coordinator. So let me go back. Here's this one. Okay. So first of all, you have a state plan, which is amazing. That's wonderful. You've taken this important step to have a state plan. So, and what the task force does is it ensures that dementia remains visible statewide, and it brings together diverse expertise. But as the number of Nevadans living with the disease increases, so does the need for coordination of services. We're talking about healthcare, long-term care supports, public safety, caregiver supports, all the things I just talked about. The government, the state has a role in that. Essential functions like Medicaid and respite, public health programs, Silver Alert, facility licensing, elder abuse protections, brain health promotion, like the things that we know can help you reduce your risk. Let's get that out there. All of these are in separate administrations, right? So there's a little bit here and a little bit there. And when I talk to folks here in the state about it, I hear there's a lot of people that care a lot. We're doing good work. But it does seem that we can do better if we coordinate these efforts. And so our request today is simple and forward-looking. It's to give Nevada the capacity it needs to accelerate your response to Alzheimer's and dementia, to build on the existing efforts that you currently have, and ensure that your state plan is not just a document full of good ideas that sits on a shelf, but it actually delivers the recommendations for your families across the state. A dementia services coordinator would focus on aligning agencies, tracking progress, and ensuring that the goals identified in the state plan translate into measurable action. Many states that have done this already, if they have a state plan, the coordinator coming in is actually that catalyst from planning to sustained implementation. Going forward. So this is our ask of you today. A dementia services coordinator would oversee the implementation and updating of the state Alzheimer's disease plan, coordinate Alzheimer's and dementia work groups and task forces, establish and maintain relationships with all relevant state agencies and community organizations to meet community needs and prevent duplication of services. They can evaluate your existing programs and services and identify service gaps within the state government and increase awareness of and facilitate access to quality coordinated care for people living with the disease. So, and this is where I have a correction on my presentation. So for the record, it says 37 states, but the answer is actually 32. So I apologize for the mistake. And I'll tell you why I found this is because I was looking at a spreadsheet of all the dementia services coordinators in the country, and there are 37. But what I found out later too was that some of them are duplicates. So some states have more than one, they'll have two, and we're talking the big states. So it's actually 32. And I said, well, Nevada be number 38. Well, I hope you'll be 33. Let's just say that. And so with that, Mr. Chair and members, I thank you for the time, and I'm happy to answer your questions as best I can.
Thank you. Thank you for the presentation. Committee members, are there any questions? Okay, I have a quick question regarding the actual uptick in the numbers, of Alzheimer's cases. I believe you said there was a 142% increase in mortality rates, and there's an expectation that by the year 2050, that number could be up to 179% increase. Is there any understanding as to what's causing the dramatic increases in the amount of cases of Alzheimer's and dementia, as well as the sort of ratio increase? I don't think it's vis-a-vis that of the population growth. It just seems to be that there's other reasons that are causing the increase. Thank you.
Thank you, Mr. Chair. That's a great question. So the question is, what is causing the increase in Alzheimer's cases? And I think that there's not a simple answer to that. First of all, our population is increasing, and the aging population especially, and we heard from the previous speaker as well about that, and because age is the number one risk factor, the number of cases will go up. I think another thing to consider is the fact that we know more about Alzheimer's now than we did 20 years ago, and we are getting better at diagnosing it and understanding it. And so the numbers again would go up for that reason as well. And I'll be happy to look into see if there's others, but those are the two big ones that I'm aware of why the numbers are increasing. But age really is the number one risk factor, and we are living longer.
So thank you. Committee members, any questions? Okay, thank you. Thank you so much for the presentation.
Thank you.
Okay, next on our agenda item, we have a presentation from the AARP. So whenever you're ready, please take the stand, as they say.
Chairman De Silva and committee members, my name is Charlie Shepard. I am the Nevada State President for AARP. Thank you very much for listening to us. And I want to thank all of the AARP members that are behind me here in Las Vegas and also those that are up in Reno for sitting in. We are very concerned about elderly services and dementia and everything else that is going on. And one thing about AARP is we are going to be there. We represent in the state of Nevada over 300,000 members. And in the US, we represent over 36 million members of AARP. On that note, I'd like to introduce our staff members that will be doing the presentation. Jessica Padron is our Associate State Director of Advocacy, and our Nevada State Director, Todd Story. Todd?
Thank you, Charlie. Chairman De Silva, members of the committee, my name is Todd Story. I am the State Director for AARP of Nevada, and I'd like to give a thank you also to the volunteers who are gathered here online and in Carson City. We are a nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age. Founded in 1958 by Dr. Ethel Percy Andrus, AARP advocates for the needs and interests of individuals aged 50 and older. On a side note, Chairman, you'll be happy to know that Dr. Andrus was a teacher. Our programs, advocacy efforts, and community engagement are designed to help create a society where people of all ages can live with dignity and purpose and fulfill their goals and dreams. In the advocacy space, AARP is strictly nonpartisan and focuses on the issues. We never endorse or donate to candidates, political parties, or political action committees. We work with elected officials like yourselves and policymakers of all parties, along with community leaders, citizen activists, and people aged 50 and over. AARP's federal advocacy operates across Congress, federal agencies, and national coalitions. Our priorities directly reflect what older Americans consistently identify as their biggest concerns: the stability of Social Security, affordable health care, especially prescription costs, and strong consumer protections. These priorities are grounded in the AARP policy book, which guides our approach nationwide. We also lead major national programs like the Fraud Watch Network and the National Caregiving Advocacy Agenda. Through our offices in 50 states, the District of Columbia, Puerto Rico, and the US Virgin Islands, we can engage with older Americans where they live, including right here in Nevada. This community engagement is accomplished through the work of more than 1,900 staff members and 53,000 volunteers who work tirelessly across the country to help older Americans live their best lives. Across Nevada, volunteers are making community presentations on fraud prevention, caregiving, healthcare, consumer issues, technology, and more. AARP Nevada volunteers staff community engagement tables, make presentations like this one, advocate to our elected officials, and so much more. Over a third, or almost 1.2 million Nevadans, are over the age of 50, whether they count themselves as Gen X, Boomers, Silent, or the greatest generation. Each generation faces many of the same issues. As you can see, the priority issues for Nevadans 45 and older are adequate health insurance, staying mentally sharp, keeping the social security that they've earned, Medicare, and aging at home. These issues track across the country, and AARP Nevada is here to empower people to choose how they live as they age. We invite anyone interested in participating with AARP to contact us at aarp.org/NV or by calling 866-389-5652. And with that, we'll now hear from our very capable Associate State Director for Advocacy, Jessica Padron.
Hi, members of the committee. Good afternoon. My name is Jessica Padron. I'm here joined by your State Director and State Volunteer President, as well as some of our volunteers, our advocacy volunteers here in Southern Nevada and Northern Nevada. So I'm grateful to be here with y'all today. And I am so glad that we were able to put together this presentation for your review and a great reference tool. So if you look at the presentation, we have a lot of great data breakdowns, including right here on the slide that I'm currently on, of some of the 50 plus populations that we specialize in. So it's going down to the granular, all the way down to veterans, folks who are in wheelchairs, hearing needs, other needs. These are the things that our research department is capable of. And I offer AARP as a service to all legislators. So if you want further information on your district or things that we're doing, this is something that we're very passionate about, which is hence why we represent so many older Nevadans here in our state. So today I was asked to speak a little bit about elder fraud, and I am very passionate about our fraud prevention work and elder abuse. So I just have some great information here for you today. Specifically, we're going to be talking about Nevada's fraud statistics. So overall, 42% of adults, that's 141 million people, have had money or sensitive information stolen from fraud. A lot of it can come from a romance scam, which we do education around, always around Valentine's Day, to make sure that folks, are aware of some of the common red flags. And that's a lot of the language we use and symbolism we've moved towards. Look out for the 3 red flags that are common, regardless of the scam. They tend to have some of the same tactics. So when it comes to Nevada protections against senior financial exploitation, did a little research and I wanted to bring it to the committee for your review. So we do currently have some protections, also what's known as a stop and hold law, but there are lots of recommendations available to improve that. So right here on this slide, I do have our current state and what is available in Nevada revised statutes, but I wanted to make sure to address it in further detail. So based on some surveys that have been taken of industry professionals, a lot of folks are very much encouraging and who have been surveyed request that the time be extended. Your typical hold can be anywhere from a few days to 10, 15 days. A lot of industry professionals, if they suspect a fraudulent expense or an older individual being exploited by a caregiver or someone else, in Nevada, we had a famous instance of that. And we do have these protections in place, but we do strongly recommend things like elder fraud training in financial institutions. A lot of them on their own, they do have some internal programs, but we would suggest making it mandatory. AARP actually has our own program that we provide to any small business groups that want to host this training. It's called Bank Safe. Also, stronger transaction hold authority. So requesting extensions, even if we don't have a set time, at least offering people, institutions, the ability to extend. If they need further time to investigate whether it's a fraudulent or act, or if someone's being exploited, give them those extra 10 days that they need, or whatever days they request. Trusted contact requirements, similar to the CARE Act that we've held passed, where if someone's in the hospital and their caregiver has to be informed before they're released, this would be something along those lines where banks can request trusted contacts consistent with federal regulatory best practices. We also have a couple other recommendations, including requiring annual reporting. It would be very helpful for the state, I believe, as well as advocacy organizations like AARP, to know how often this is being used. And right now that's not very transparent. It would be very helpful to know what other safeguards need to be put in place and how to continue protecting folks from being exploited. So I wanted to get into a passion project of mine. Our organization has been, as always, listening to our members and following trends of what their needs are and where fraud is being conducted the most. And we have come into a motherlode of very concerning information regarding crypto kiosk ATMs. So crypto ATMs, they look just like a normal ATM, most of them. There was an instance at a Reno Costco where they had no clue that it was a crypto ATM, and due to some advocates informing them of their concerns, they actually yanked it. What crypto ATMs do is they allow users to insert cash and then convert that to cryptocurrency, which is non-traceable. It's all through a blockchain. I know lots of members of the Ledge are very aware of crypto. Through the last couple sessions, there's been lots of conversations around that. But crypto kiosks are regulated as money service businesses at the federal level, but they lack state level regulation in several states, including Nevada. And one of the things I want to highlight is super high fees to exchange funds. So in addition from converting your real dollars to Bitcoins, it is a very high conversion rate. So how did these scams work? What happens is we see consistent nationwide is that criminals coerce victims into using the kiosk as a payment method. So back in the day, there was lots of education about gift card scams, right? Please, if someone calls you in a very alert tone, like, please immediately, in order to pay your bill that you owe, or you will have a warrant for your arrest, or something along those lines, they'll say, we need you to drop off a $500 gift card at this location or at this drop box. That's clearly a red flag that it's probably a scam. These days, what they're doing is they will convince the individual who is being scammed to go to one of these crypto ATMs. And in one case, there was an older woman who took thousands of dollars from her retirement fund and was putting $100 bill at a time in the machine. And the convenience store worker, because many of them are in convenience stores, anywhere you'd find a regular ATM, felt bad for her. So they pulled up a seat for her so that she could deposit her entire life savings into the machine. Right here on the slide, you'll see some of these victims. And a lot of them, there have been so many complaints since 2024. The victim can only resolve by sending these funds through the machines, according to the scammer. And the script typically unfolds. The scammer reaches them by phone, text, email, social media with a fake tech support pop-up, and they'll say, create urgency. So that's red flag number one. If someone's asking you for money and says they need it right now, they don't give you time to think about it, your loved one's in trouble, whatever the scam is, and they need that money right now before you can cool down and think about it, that's one red flag. You see, what happens is, they'll say that the crypto kiosk is safe, secure, it's the only way. And then after the transfer, recovery of the funds is almost impossible. So based on the FBI IC3 framing used in a lot of our AARP materials, crypto kiosks are heavily used in scam categories like tech support scams, government impersonation scams, extortion, which actually is more common than one would think, investment scams, and they design these scams to trigger strong emotional response. So just a little bit of a breakdown there. That is from the IC3 report from the FBI, and it contains over 10,956 complaints, which equates to over $246 million in losses from folks who have deposited money into crypto kiosk. So breaking that down here to Nevada, I just wanted to alert legislators because I think very few folks know, even us, it wasn't made this alarming to us until recently, that Nevada ranks within the top 5 states per capita of these crypto kiosks. One of my colleagues went to a convention and was speaking with other industry experts, and they had maybe a few in the state. We have so many of these just in Clark County. So I provided that map for y'all right there. And as far as regulation, limitations, protections, putting those things in place, Nevada thus far has not done that. So we would highly suggest that this committee investigate taking action. So some of the suggestions that we'd like to present to the committee include licensing of kiosk operators as money transmitters, and specifically daily transaction limits. That is key. Maybe someone needs to make a transaction on crypto, and we're not anti-crypto. Some folks are very much into these investment tools, but we do find that it is one of the top methods used for fraud, not just with seniors, for everybody, but seniors are particularly vulnerable. Last legislative session, we did work on legislation, fraud restitution bill for victims of fraud, but that was for securities fraud. This legislation would target specifically these crypto kiosks or ATMs. We highly suggest paper receipts for transaction, usage of blockchain analytics, specific warnings. And some of these do have like a sticker on it or something. It'd be great to have like a screen so that folks can actively be more aware, but it is very concerning. And I think it is something of the utmost importance for this committee to further review. In our conversations with law enforcement, they've made it clear sometimes folks are so scared from these scammers that a police officer would try to stop them and say, ma'am, this is not legitimate. We do not have a warrant out for your arrest or what have you. And they refuse to believe it. If that money isn't deposited, they are made to fear for the life of a loved one or whatever the tool or tactic the scammer used. So in addition to this priority recommendation, we do also want the committee to be aware we do work on fraud, of course, overall, but caregiving is a priority of ours. We did work with the Alzheimer's Association last session to help pass SB 329, which is dementia training for EMTs, folks, first responders out there, to help know the sign is if someone is someone with dementia or some sort of cognitive impairment, so to prevent further escalation. And if we could be of service in any way, please let us know. Our motto is to serve and not be served. So please feel free to reach out to us. And if there are any questions, our contact information is provided right there. And we look forward to staying very active during the interim and the coming session with this committee. So thank you very much for your time.
Thank you. Thank you. Committee members, are there any questions? Please go ahead, Senator.
Thank you very much, and thank you for the information. How do, aside from belonging to AARP, how are we getting this information out to our seniors?
Thank you, Senator Dondera Loop. Todd Story for the record. There's a number of ways. The information is available on our website, first of all, that I shared earlier. That would be arp.org/NV. They can call the office as well. That information is included on the slide. We're happy to share that. What we have coming up here in April, starting in April, is a fraud prevention blitz, where nationwide, every AARP office in all the 50 states and the other territories will be holding various events throughout the month of April to educate the public. So we have, I think, a total of 12 events that are planned here in the state of Nevada, both here and in Reno. We have some that will be online through teletown halls, so people can join virtually as well. And then the big event that we will hold at the end of the month is going to be at the Mob Museum on April 30th. It's called The Evolution of Deception, from Organized Crime to Cybercrime. We're proud to have Las Vegas Metropolitan Police Department participating with us in that effort. So knowing that there are lots of opportunities for scam artists to take advantage of older folks, we're here to educate and prevent as much of that as possible. And certainly with the work of this committee, we can even do more.
Any further questions, committee? Yes, Senator Rokich.
Thank you, Chair. Thank you for the presentation. With regard to the kiosks, are they owned or are they leased when they're when they're located inside a convenience store or a gas station? Who operates those machines?
So there, Jessica Padron for the record. There is a number of companies, it could be Coinbase, and many of them are legitimate businesses. They just don't have very many regulations here in the state of Nevada, which is what we're hoping to address. And one of the companies, at least that I'm aware of, has made contact with the officer that we've been in communication with that specializes in this type of fraud on some of the awareness that they're trying to do. So I think similar to other industries, there are folks that are willing to be proactive. And if we bring in, if we work early to put in some of these standardization of requirements, I think there would be a lot more protections in place across the industry, regardless of the operator.
Questions, committee? If there's no more questions, I have one last question here. And, you know, I'm glad we're having this conversation about some of the scams, particularly financial scams that have been affecting so many of our seniors. I know that we all get, you know, emails every month, you know, about this issue. So I'm glad that we're having this agenda item today for our hearing. My question is about the formation of a Nevada Elder Financial Protection Network. I know that was one of the recommendations that you made. How, in your view, would that look like? And then can you go into a little bit of more depth in detailing what this sort of a network would really encompass?
Yes. So recommendations include looking into some of our sister states through AARP have been successfully passing regulations on crypto, including things like an oversight board. We would recommend including folks from AARP, of course, as a stakeholder, someone from the industry, representatives from the state, other groups that have a shared vested interest, not only in protecting consumers. So consumer protection is one of our key tenets. That's why we work with the FBI at the national level, but someone who also can work on presenting some of the instances of these issues. So what that would look like would be at the determination of this committee, but we are very eager to be a stakeholder included in those conversations.
Thank you so much for your presentation. Okay, we will next move on to agenda item 6, I believe it is. It's agenda item 6, which will be a presentation on the overview of the Vulnerable Adult Fatality Review Committee report pursuant to a state statute. Presenters will be Michael Morton, Chair of the Vulnerable Adult Fatality Review Committee, and Robin Tejeda, Social Services Chief 2, Aging and Disability Services, Division and the Department of Human Services. Okay, so I believe they're in Carson City. You may begin when you're ready.
Good afternoon, Chair De Silva, Vice Chair Cruz Crawford, and members of the committee. My name is Mike Morton, and I serve as the chair of the Vulnerable Adult Fatality Review Committee. I have served as the chair of the committee since its creation in 2023, and I'm honored to lead such a hardworking group of public servants from across the state as we continue to identify disparities in the care of older and vulnerable adults, as well as solutions to fill those gaps. During this presentation, I will briefly explain why the Vulnerable Adult Fatality Review Committee was created, how the committee operates, the nuts and bolts of how the committee works, and how we see the committee serving the residents of Nevada going forward. The Vulnerable Adult Fatality Review Committee was created by the Nevada Legislature in 2023, tasked with examining deaths of older and vulnerable adults where abuse, neglect, exploitation, or isolation may have played a role. One fact that is extremely important to note is that the purpose of the committee is not to assign blame to any entity or individual, or how to reinvestigate or relitigate a case. Rather, the committee's charge is to understand how the death occurred and how the care system throughout the state could be improved by identifying existing gaps or disparities in elder care and providing recommendations to this body on how to remedy such disparities. With that backdrop, let me provide a brief overview on how the committee performs its duties. Cases involving suspected maltreatment of an older or vulnerable adult are referred to the committee in one of three ways: from the Division of Aging and Disability Services, from law enforcement, or from an adult relative of the decedent. Specifically as to the third way that a case can be referred, the committee and division staff have worked extremely hard over the past year to create a referral system that is accessible to the public and can be now found on the division's website. The committee has issued press releases and conducted local news interviews to help the public understand that this committee exists and the type of work that is being done. When the committee is referred an eligible case for review, it gathers as much information as possible, including medical records, death certificates and autopsy reports, records from any facility or provider that cared for the decedent, and if they exist, any law enforcement or investigative reports associated with the case. The goal here is to reconstruct the circumstances leading up to the death and identify any missed opportunities for intervention. The committee's work in conducting these reviews is focused on prevention by identifying contributing factors in the death and gaps in the care delivery system. Changes recommended by the committee can influence policy, training, reporting procedures, and coordination between state and local agencies. I will note that while the committee's focus is on strengthening the care delivery system to prevent future deaths, it does have the authority to refer a case to the Attorney General's office for criminal investigation if the facts of the case so require. The committee's most recent report to the legislature makes clear that abuse of older and vulnerable adults remains a significant statewide issue, reminding us that the cases reviewed by the committee likely represent only a fraction of such maltreatment. Although only 5 fatalities met review criteria last year, the committee has already identified meaningful patterns. In particular, gaps in communication between adult protective services, law enforcement agencies, and other state regulatory entities. Challenges in oversight have also been highlighted, especially related to contractors and individual caregivers who may move between facilities after alleged wrongdoing. The committee's report emphasizes that what the committee learns can be used to promote policy changes and positively impact the health and safety of this vulnerable population. The committee's key message to this body and to the entire legislature is that improving interagency coordination, strengthening oversight, and expanding reporting requirements will help protect Nevada's vulnerable adults and reduce preventable deaths in the state. committee appreciates this legislative committee's time and attention, and I am happy to answer any questions that you may have.
Committee members, are there any questions? Assemblymember Karas.
Thank you, Chair, and thank you for the presentation. You mentioned that you found gaps, but you didn't tell us what they were. What is happening with miscommunication?
Michael Morton for the record. The gaps that have been identified are listed in the report that we submitted to the legislature at the beginning of this year. Some of them include just the sort of lack of coordination, sometimes between states and local entities. A lot of these entities are sometimes doing the same work, but not talking to each other. So there may be a case open with a local law enforcement agency and a very similar case open about the same person or facility opened with Adult Protective Services, but those two agencies are not aware that those two cases are open simultaneously.
Thank you. Thank you for that answer. Thank you, Chair.
Committee members, are there any further questions? Okay, thank you. Thank you so much for your presentation. At this time, we will move on to agenda item 7, which will be an overview of home and community-based waivers and resources. And we will have presenters from ADSD as well as DHS. You may begin when you're ready.
Good afternoon, Chair De Silva, Vice Chair Cruz Crawford, and members of the committee. Thank you for having us here today to present to you. My name is Adrienne Navarro, and I am a Social Services Chief within the Office of Community Living with the Aging and Disability Services Division. I have with me here in Carson City today 2 of my colleagues and also 1 in Las Vegas. They will introduce themselves as we move through the presentation. In the last presentation to this committee, ADSD presented on the home and community-based waivers. So for today, we will actually be going into more detail about other resources that ADSD has to offer adults, including an expanded overview of the Office of Community Living, the Adult Protective Services Program, a couple of additional advocacy programs, and we'll wrap up looking at legislation from the 2025 session that impacts older adults. This slide provides information about ADSD's mission and vision. As a recap, in our February presentation, we gave a brief snapshot of the programs available across ADSD, focusing on data including wait lists for all programs serving older adults and people with disabilities. That presentation also focused on home and community-based waivers, as well as developmental services. We also provided follow-up responses to the questions received after that presentation. Here you will see a broad list of programs or units within ADSD that serve adults. Today we will be focusing on Adult Protective Services, the Long-Term Care Ombudsman Program, the Office of Community Living, the Office of Consumer Health Assistance, and after this presentation, there will be a separate presentation from our Office of Attorney Rights. First, we'll talk about our Office of Community Living, which offers a variety of programs and services for older adults, people with physical disabilities, and family caregivers that empower individuals to live independently in their communities. During the last presentation to this committee, we focused on the PAS and COPE programs and the Medicaid waivers. In the next few slides, we will go further into other Office of Community Living programs and services. This slide shows the variety of community services that are offered through grants, or what we refer to at ADSD as subawards, to community partners throughout the state. In state fiscal year 2025, we had nearly 400 active subawards with 80 community partners. These services are primarily funded through federal funding with limited state general funding. In state fiscal year 25, we served just over 60,000 clients, and we granted out approximately $30 million to community partners. In addition to the service categories listed on this slide, ADSD utilized American Rescue Plan Act funding, as well as coronavirus state fiscal recovery funds, to support a range of programs to reduce wait lists, enhance telemedicine services, increase outreach and marketing, and advance workforce development capital improvement projects. One of our core categories is access to services, which is a suite of programs designed to help individuals navigate our system and connect with services. We have Nevada 211, which is the state's information and referral line for health and human services. Next is Nevada Care Connection. This is a service that goes beyond information and referral to help people evaluate options to meet their goals and assist with accessing public and private service options. And lastly, we have the Medicare Assistance Program, which provides free, unbiased education and assistance related to Medicare, including education to help prevent, detect, and report Medicare fraud. Next, the Communication Access Services Program provides communication access to Nevadans of all ages who are deaf, hard of hearing, or who have a speech disability. This program is fully funded by the Telecommunication Devices for the Deaf surcharge, which is a surcharge on all landline and cellular phones in Nevada. The services in this program include Relay Nevada, the Nevada Sign Language Interpreter and CART Registry, a Sign Language Interpreter and Mentoring Program, and services provided by community partners, which include telecommunication equipment distribution, language acquisition through American Sign Language classes and deaf mentoring, and assistance with accessing services. ADSD also has a combination of federal and state funds to help support people to transition from nursing facilities or other institutional settings back to the community, or who need assistance to avoid institutional placement. These programs offer discharge planning, transition coordination to ensure appropriate services are in place for community living, and financial assistance to support basic transition costs that are not covered by other programs. These are relatively new programs within ADSD and are growing. Lastly, ADSD has a range of councils and commissions that the Office of Community Living supports. These councils and commissions serve as advocacy bodies within our state and offer a range of recommendations to state agencies and the legislature on issues that are important to the specific communities they serve. Across these 10 councils and commissions and their subcommittees, we help support over 120 public meetings per year. And I'll now turn the presentation over to my colleague, Robin Tejada, with Adult Protective Services.
Thank you, Chairman and Committee. My name is Robin Tejada, for the record. I am the Chief of Adult Protective Services, and I will provide a brief overview of APS, senior fraud, and abuse. Adult Protective Services protects vulnerable adults by responding to reports of abuse, neglect, self-neglect, exploitation, isolation, and abandonment. APS serves adults 18 to 59 with vulnerabilities, as well as adults 60 and older. APS works to prevent further maltreatment while safeguarding civil liberties. APS supports each person's right to self-determination and honors the dignity of risk, ensuring individuals can make their own choices while receiving the protection and assistance they need. For state fiscal year 2025, APS demographics show that almost 60% of individuals served are female. Approximately 13% of APS cases involve adults under 60, and approximately 60% of all APS cases involve adults aged 70 and older, with the largest group being those between 75 and 84. This highlights the increasing risks that come with advanced age and the importance of targeted support for our older community members. Also for state fiscal year 2025, about 28% of APS investigations were substantiated. The remaining 71% were unsubstantiated, which is important to interpret correctly. As unsubstantiated findings doesn't mean that a concern wasn't real, it simply means there wasn't enough evidence. Many APS situations happen behind closed doors, involve limited witnesses, or include adults who may be unable or hesitant to share details. Even when a case is unsubstantiated, APS often still provides support services and safety planning for those individuals. APS and financial fraud. Under Nevada law, financial exploitation is defined as a situation where a known person, someone in a position of trust, uses the relationship to obtain money or assets from a vulnerable adult. Because of this definition, APS does not investigate financial fraud or scams committed by strangers. Those cases fall outside our jurisdiction and are referred to the Attorney General's office, the FBI, or local law enforcement. It's also important to note that Nevada law requires mandatory reporting from financial institution when exploitation is suspected. This requirement outlined in NRS 657.290 helps ensure that potential financial harm is identified early and reported to APS for further review. Overall, APS focused specifically on exploitation involving trusted individuals, while fraud by strangers is handled by other investigative agencies. However, if there is a component of self-neglect, APS will open a case and provide support. Additional laws to know. APS has several important laws that guide how to help protect vulnerable adults. Under NRS 159.044, APS can request guardianship or petition for guardianship, but only as a last resort when someone is experiencing severe self-neglect, abuse, or exploitation and cannot protect themselves. APS also has the authority under NRS 200.5095 to obtain financial and medical records without a warrant during an investigation, which can help to identify risk and potential harm. Nevada's Uniform Power of Attorney Act allows banks, hospitals, and others to refuse a power of attorney if they suspect it is being misused or if there is an APS investigation. And finally, NRS 41.1395 allows courts to award enhanced civil damages up to double, I have on the slide triple, it's double the actual damages when an older or vulnerable adult is abused, neglected, or exploited. These laws strengthen our ability to intervene, protect, and hold offenders accountable. Recommendations for future policy consideration. Looking ahead, there are several policy considerations that could strengthen APS's ability to protect vulnerable adults. Expand APS's legal authority to petition the courts for temporary or emergency protective orders when an adult is in immediate danger. Authorize APS to request administrative access warrants when abuse or exploitation is suspected, allowing timely access to environments where safety concerns exist. APS could also benefit from a process that allows the agency to seek court-order-approved emergency financial holds to stop ongoing financial losses. In addition, courts could be given the authority to restrict or block specific individuals from accessing a senior's financial accounts when exploitation is occurring. Finally, enabling APS through the courts to issue orders directing banks to pause withdrawals or transactions during an active exploitation case could provide critical protection while an investigation is underway. These policy improvements would give APS stronger tools to act quickly, reduce harm, and better safeguard vulnerable adults. So next on our presentation is more advocacy work that ADSD does from Marie Coe.
Thank you and good afternoon, Chair and members of the committee. Thank you for the opportunity to provide additional information about the Nevada's Long-Term Care Ombudsman Program, and I serve as Nevada's State Long-Term Care Ombudsman, and my name is Marie Coe. Our mission is to ensure that residents in Nevada's long-term care settings receive the highest quality of care while honoring each resident as a unique individual. Ombudsmen visit the licensed facilities monthly, giving residents consistent and timely access to advocacy when concerns arise. During these visits, staff also provide education on resident rights and best practices in long-term care. The program investigates complaints related to quality of life, health, and safety, and when possible, the Ombudsman obtains consent directly from the resident, and should the resident not be able to provide consent, we work with their legal representative to move forward appropriately. We also participate in many outreach events statewide to raise awareness and ensure the public knows how to reach us. And to further increase accessibility, the program recently launched an online complaint form that allows community members to contact us at any time, day or night through this method. The Ombudsman Program regularly reviews data trends to identify areas where systemic advocacy is needed. In 2025, we saw increases from 2024 in these 5 noted areas. The first, care planning, was the most frequent concern. And these cases involve residents' individual daily needs, such as who they want to visit, activities being done during the day, food preferences. And just as each of us has our own routines and preferences, residents do as well. The challenge is that they now rely on staff to support those needs, and staffing limitations can prevent them from receiving that support. The next is reports of physical abuse. Both resident to resident and staff to resident have increased. Trends suggest these incidents are often connected to insufficient staffing again, reduced supervision, and unmet resident needs. The program placed significant focus on preventing unsafe discharges. We have partnered with our legal aid organizations statewide to ensure residents had representation during discharge appeal hearings. These efforts have been successful in maintaining resident safety and ensuring the care needs continue to be met. Concerns about stolen, lost, or missing property have also increased. Many residents have limited financial needs, and some belongings hold sentimental value and cannot be replaced. We continue to advocate for improved inventory processes and securing storage options to reduce the loss for the residents. And finally, unanswered call lights have a direct and serious impact on resident care. Delayed responses may result in residents being left in soiled briefs, hydration needs going unmet, or pain medication being delayed, as just a few examples. The residents in care settings, because they require support, and call light response times reflect how well their needs are being met. And on my last slide today, this slide highlights the number of facilities our staff visit regularly. In addition to the facility visits, we've also attended 30 outreach events. And you can see the number of facilities on the slide and the different levels of care, such as skilled nursing facilities, residential or assisted living facilities, our smaller homes, which are a 2-person home, homes for individual residential care. We have, in the last few years, been going to adult day centers and advocating, and then the intermediate care facilities as well. And a new facility that we will begin going into are the mental health rehabilitation facilities this July. Our program consists of 29 ombudsmen statewide who cover all of these different facility types and visit residents monthly. And supported by 4 supervisors and 6 administrative staff. So we are a small but mighty team, and we are very dedicated, compassionate, and deeply committed to the residents we serve. We appreciate your time today and look forward to continuing to work together. Thank you.
Thank you. I believe we have a question from Assemblymember Edgeworth.
Thank you, Chair. Thank you for the presentation. What a great presentation, lots of data. Do you, just a quick question on slide number 23. Do you have any thoughts on why between 2023 and 2025 there was a 45% increase in reporting? That feels like a big increase in 2 years. Is it because you're getting the word out and it's better messaging?
Thank you for the question, Marie Coe. Again, for the record, yes, we did make a change in the program to be visiting the facilities quarterly. That was what we were previously doing, and now we are visiting them monthly to increase the access to the residents, to the family members who are also at the facilities, staff members, educating them on resident care and when to be reporting. And so our numbers have increased for cases from 23 to 2024.
Thank you. Can I have a tiny follow-up question? Sorry, so am I to understand, I'm amazed, that's interesting. So am I saying, you're saying that each facility is being visited monthly? Obviously not each resident, but each facility? Is that accurate?
Yes, Marie Coe, for the record, the larger facilities, our skilled nursing facilities, we attempt to visit 20% of the residents in those facilities every single month. And then our smaller facilities, which could be 5 to 10 people in all of those facilities, we visit with every single resident every month. We have 2 teams within the program. One is dedicated to doing monthly visits without complaints. Our goal is to ensure access. So a resident that might be bedbound, that might not have a way to contact us, we want to make sure that they have access to us. Then our other team gets the complaints and investigates when those complaints are received.
Thank you. Thank you, Chair.
Any questions, committee members? Okay, I have one question here to close, and that's going back to your overview of adult protective services. And you mentioned that there's a bifurcation really when APS is involved, and then other sort of instances that are then I think under the purview of the Attorney General, the FBI. So if there is a strong evidence of exploitation taking place by a known person, you know, I think that's under the purview of APS. So what's the process there? What would take place if there is some evidence that is found, and how does law enforcement or the other entities get involved in making sure that justice is served? Thank you.
Sure. Thank you for the question, Robin Tejada, for the record. And I also do want to note before I answer that question that ADSD still has one more unit to give a presentation. OCHA, Kadisha's there in Las Vegas. But if I'm understanding your question, if APS finds that exploitation has occurred, what's the next step? Is that what your question was?
Yes, that's correct.
We would work with law enforcement partners. We refer cases to, once they're substantiated, we refer cases to local law enforcement and the Attorney General's office at the same time. We do that with the consent of the clients that we serve. Sometimes there's exploitation that does occur and the client doesn't want us to report, and we respect that. But if they do want us to report, we have a mechanism to report those cases to local law enforcement.
Thank you.
Thank you.
Committee members, any further questions? Okay, I guess we'll then thank you again for your presentation. We'll now move on to agenda item 8, which will be another presentation from ADSD.
Good afternoon, Chair. If I might clarify, under number 7, there was one more slide deck by the Office of Consumer Health Assistance. For the record, my name is Shauna Brennan, and I will be next.
Okay, sorry about that. Yeah, I just noticed that as well. Yeah, let's go back to agenda item 7 and then complete our presentation there. Sorry about that. Thank you.
Thank you, Chair and committee members. For the record, my name is Kadisha Carter, and I'm the Operations Chief for the Office for Consumer Health Assistance. We like to call it OCHA. OCHA is committed to empowering individuals with the knowledge and support they need to make confident, informed healthcare decisions. Within our program, we have healthcare advocates and we have community advocates. So the healthcare advocates are tasked with filing appeals on behalf of consumers for services that have been denied or requested, quality of care complaints. We assist with medical and dental billing issues, hospital billing issues. That service is given through the Bureau of Hospital Patients, which is the only regulatory authority that our agency has. We have the authority to mediate or arbitrate any hospital disputes between a patient and the facility. Explaining patients' rights and responsibilities under their health plan, or explaining their rights and responsibilities under the financial consent forms that they sign when they are seen by providers or admitted to facilities. We assist with resources for the underinsured and the uninsured, and guide injured workers through the Nevada workers' compensation process. We also assist consumers with identifying financial assistance programs. Our community advocates' primary responsibility is to provide guidance and advocacy to the Nevada's older adults and individuals with disabilities. They provide referrals and resources to programs, benefits, and supportive services. They also conduct home visits to assist with applications, make food deliveries, or essential item deliveries. The community advocates also manage and disperse emergency funds that are available to individuals over the age of 60. So those funds are available to help meet an unforeseen financial hardship for consumers 60 and older who do not reside in a facility. The community advocates represent the program at community events where they distribute informational material and build relationships with local organizations to expand awareness of the available services through ADSD. Some of those referrals come from senior centers, communities, elected officials, and other community partners. Those come through our intakes, which we receive via telephone, email, and walk-in services. Although OCHA services all populations, this information is for the last 4 calendar years. We did service 2,292 adults 65 plus and 970 individuals with special needs. To end, we'll just show some 2025 legislative session bills. So while ADSD may not have responsibility for implementing the bills listed below, these bills impact older adults. Assembly Bill 461, long-term care planning. Senate Bill 60 expands types of crimes committed against older adults and vulnerable populations with enhanced penalties. Senate Bill 207, establishment of the PACE program, which is the program of all-inclusive care for the elderly, and Senate Bill 299, senior living community requirements for renewing registration with the Division of Public and Behavioral Health. And at this time, we'll take any questions.
I think for real in closing this time, are there any questions from the committee members? Okay, seeing none, thank you for your presentation. And again, sorry about that. I thought we had moved on to the next agenda item, which we will do now. We will now move to agenda item 8, which will be another presentation from ADSD. And our presenter will be Shauna Brennan, Advocacy Rights Attorney.
Thank you so much. For the record, my name is Shauna Brennan. I'll start the presentation while they locate the PowerPoint. We're ready. Today, I'm going to be discussing, well, introducing myself in a little more detail. I know I was introduced at the last meeting. An overview of what the position is empowered to do by statute and federal law. Some of the current legal issues that are being experienced and making their way to my office, the services we offer as legal service provider, coordinating the legal aid, implementation of AB 161, which is Hospice Bill of Rights. That'll be at a little more particular detail. And also the implementation of AB 461, long-term care planning. Then I will provide my statutes that apply to my office. I am a Nevada attorney. I am required to be licensed in Nevada, and I am appointed by the governor. I also serve as legal assistance developer under the Older American Act, and I am a member of the Guardianship Commission. I am a graduate of Notre Dame Law School, and I am passionate about the legal rights of older people and people with disabilities. I do live in Henderson, Nevada. The objective of my office is to support legal rights, coordinate and provide oversight of legal assistance, and identify and mitigate abuse of older and vulnerable adults, people with disabilities, and that includes physical disabilities, intellectual disabilities, and developmental disabilities. Under my statute, I can provide technical legal assistance and legal resource development. An example would be the Task Force for Alzheimer's Disease had asked me to provide a white paper on the difference between capacity and competency and how that is treated under Nevada law. That's an example of what my statute authorizes me to do. I can investigate, I can intervene, and I can cooperate with enforcement. So the preceding divisions of aging and disability, I work with all of them and they refer to my office. That is Adult Protective Services, Long-Term Care Ombudsman, Office of Consumer Health Assistance, and also our office of, basically every ADSD office. They will call me if there's an issue. For example, the regional centers will call me if a person with special needs is having a right infringed. That would be a good example of supporting one of our other divisions that's not necessarily investigative. They have direct contact with the population. Interesting, my statute authorizes my position to implement a financial management program. I'm not sure why that's housed with an attorney, but it is in the statute, and I'm exploring those programs. Right now, Oregon has a very good financial management program. I'm working with Ricky Robb, the administrator, to proceed with recommendations for that program. I coordinate legal assistance as a legal assistance developer. That is federal statute. I can act as amicus curiae, which is our Latin term for the day, and that means friend of the court. And I have had occasion to file a couple of amicus curiae briefs in cases where there was an issue, in particular abuse of power of attorney, another issue about capacity. If I reviewed the filings and did not believe that either side was presenting all of the state of the law to the judge, then I can file an independent brief. And the judges are very interested in really any kind of resource that they can get. It was well received. And as I mentioned, I serve on the Guardianship Commission. Some of the issues that we're seeing now that are facing our most vulnerable are housing stability. I see that this will be coming up later today. Eviction legal defense, which is provided by our legal aid providers. It's an interesting gap that many landlords who are elderly do not qualify for legal aid because they're not the tenant, yet people are moving in and squatting in their homes and they're having difficulty getting them out. So that is an initiative that is trending, and I'll be looking for ways for us to locate legal representation. These are complex civil real estate cases, but yet our most vulnerable elderly people are landlords also. So it's a very interesting situation. And that is one of the objectives of my office, is to recognize gaps in legal services and vulnerability. We also provide assistance and services for the frail elderly. And one of the issues we're seeing is people may be required to attend a hearing, yet they're not able to go to the hearing because they're housebound. I did recently obtain a restraining order, a temporary restraining order on behalf of a 102-year-old homebound who is the full-time caretaker for her 77-year-old son with severe autism. However, 3 months later, the restraining order was not continued because that particular hearing officer decided the woman had to attend in person. Okay, this is a travesty, and it's one of the issues that we're addressing in our office. And so the goal would be able to have maybe another person with her with a laptop so that she could Zoom in. Obviously, she can't navigate. Well, maybe she could, but in her case, she has a little hearing and sight problems. So she would have difficulty joining that hearing on her own. But that's an example of the type of issue that we're identifying, and we'll put into place the type of technical services and human assistance appropriate. We are seeing a rise. Powers of attorney are wonderful, and they are deterrent to guardianship. They are a least restrictive alternative. Unfortunate, we're seeing a rise in abuse of power of attorney. And so we are addressing that and possible ways to combat that. And I think mostly through education and programs such as a financial management program, the other wonderful programs that AARP is recommending to reduce the fraud. We see issues relating to hospice and medical personal care assistance. Again, just the most extreme cases, I would say for the most part, our service providers are doing a wonderful job in Nevada, quite impressive job. But the worst cases make it to my office, you have to understand. Other issues relating to aging in place. These mostly involve family members who are pressuring people to be institutionalized. Again, APS or long-term care ombudsman will call me. We're sometimes seeing isolation issues. And so I will, if possible, go in person to make sure that the loved ones, well, usually it's a relationship, like maybe a girlfriend, or the neighbors are able to access someone who has been placed into a long-term care facility. Because sometimes their power of attorney feels threatened, and so they try to isolate them. So that's an example of what we're able to do in my office. I provide legal service coordination, which is just a continuation of the funding. All the great administration of the funding is done by Office of Community Living, and then I just review the scope of the legal services and the quality of the work. I want to turn now to AB 161, which is revisions to hospice care. Key changes to the hospice care law include adding ethical standards, financial conflict of interest, requiring notice of the services, and requiring patient consent. The licensing and license complaint reside under the Nevada Health Authority with HCQC, which is the Bureau of Health Care Quality and Compliance. That's a very important avenue, and they've distributed to the licensed hospice facilities what the requirements are and the avenue for enforcement. We have met within ADSD and discussed the individual rights and what would be an appropriate avenue for complaints for a violation of individual rights. And those complaints will go to Adult Protective Services, and as necessary and appropriate, APS will refer to the Long-Term Care Ombudsman, the OCHA, Office of Consumer Health Advocate Assistance, or my office, Office of Advocacy Rights Attorney. We're also developing education and outreach about individuals' rights in hospice, which I'm calling the Hospice Patient Bill of Rights. And we're identifying first responders, service providers, and other avenues to the public to disseminate that information. I'll turn now to AB 461, which is long-term care planning. It required ADSD, Aging and Disability, to develop a program to carry out a public awareness campaign about the importance planning for long-term care, to maintain information on a website with resources that are available, to coordinate with stakeholders and industry professionals, and then to address specific demographic segments. You might think about, say, the rurals or our Native American population. That would be a specific demographic population. This responsibility sits in the Office of Community Living, and they have identified their No Wrong Door initiative and Nevada Care Connection as the responsible avenue for disseminating this information. And they have identified federal funding to help to increase the outreach efforts But at this time, that is not guaranteed to be sustained. So that's something you might be mindful of next budgetary go-arounds. My office implementation includes moving forward to develop the financial management program. We think that this would be a critical element of long-term care planning. Again, especially for our most vulnerable people, you may be familiar with the Rep Payee service, would be something along that line, but it would have even more so that your pay would be based on your financial need or inability to pay, let's say. And then if you were able to pay, and in the population, such as myself, I am age 60 or over, I am a widow, I have no one in the state to manage my affairs, I might sign up. But because I have financial resources, I would pay a fee. This way, I ensure that if I hospitalized or something happens, my bills will continue to be paid. This is an example of how this would work. And so again, we're looking at the Oregon model, and we'll get back to you later this year. Also, we are reaching out to law firms and legal aid to increase our workshops. I know they were doing a great job with estate planning, which includes power of attorney and advance directives. Many of these areas are not supported by grant funding. The challenge we're having is in the area of the complex litigation. So we are looking for additional funding so that where our vulnerable population is fighting to save their home or fighting to claw back some of the money that's been taken, that the state would be able to provide the funding for that. Right now, there is not legal aid funding for that complex civil litigation. I'm not going to go over the particulars, but it's in your handout. Both my duties are listed here, as well as how my office is implementing those specific duties. So at this time, I would invite questions. Thank you.
Thank you. Committee members, are there any questions? Yes, Senator Rogich.
Thank you, Chair, and thank you for the presentation. I'm just interested at the moment with regard to the abuse of power that you're seeing and the increase in that among family members. And so what are the patterns that you're seeing in those type of cases?
Thank you for the question. For the record, my name is Shauna Brennan. It's not just family members, unfortunately. I would say for family members, it's generally a revision to the existing estate planning documents or taking the vulnerable person to an attorney and then getting new, documents drafted for the first time that are very one-sided that only benefit them. Sometimes it's the enactment of the existing estate plan, but the person is taking action that the principal is objecting to. So we will enter a situation where the principal is objecting to the treatment. The power of attorney is attempting to override them. And so my position is that a power of attorney is revocable and can be terminated. And so generally I see then the power of attorney individual will escalate and claim dementia or Alzheimer's and attempt to invalidate the wishes of the individual. This is the most common that we're seeing, or again, a change or alteration. Unfortunately, where it's not a family member, it's someone who they've met and entrusted in the community, generally at a casino, who says they will become their friend. They secure a power of attorney. They convince them to move into a home with a lot of people, an unlicensed group home or whatever we choose to call it. And then they dispose of their assets. And then when their money isn't sufficient to pay the rent, they kick them out. And it's a path to becoming unhoused. So we're aware of this and we're watching for this, but it is happening with regular frequency.
How do the families find you? So if you have an individual that's going through that experience and they're being taken advantage of, who reaches out to you? Is it the court, or does it reach a point where the court gets involved and then they contact you? Or
Thank you for the question, Shauna Brennan. For the record, I have actually been contacted by the courts, and a judge in particular was concerned about a landlord having a defense. And so he called me to come to the hearing. And my statute allows me to appear on behalf of a person without an engagement letter or being paid until an attorney is appointed. It's a very rare and special superpower, which I don't invoke very often, but in that case, I was able to appear as their attorney and then defend the action by this kind of squatter, hostile person who is trying to take over their house. So in that case, in some cases, generally though, it's internal from another ADSD division, and they see not only is it maybe an isolation or self-neglect, but that the individual rights are being impinged by someone else. So that's a prime example. And they contact me immediately, and then we have regular calls and meetings about the difficult and complex cases. And enforcement is really the biggest issue because I have powers under my statute, but like these other ADSD divisions, we don't really have enforcement power. So at that point, it's enlisting the local authorities or say HCQC because they're enforcing licensing. So this continues to be a challenge for us to protect rights is the enforcement issue. Thank you.
Any other questions, committee members? Yes, please. Assemblymember Karras, please.
Thank you for your presentation. I want to say you're going to be like the Wonder Woman for all of us old, aging people. So thank you very much for the work you do.
I have one question. So I know you did mention that that you work with law firms to solicit pro bono work. And can you just describe how those relationships have been playing out? And also if there was a particular ask that you would make of the state, to fund some of the work that's being done, through your office, particularly with the pro bono lawyers and the grant monies that you were talking about. Is there a certain dollar amount that you could think of at this, or is it too early to talk about those budget?
And thank you for the question, Shauna Brennan, for the record. The legal aid is coordinated through our legal service providers. So these are the ones you're aware of, the Senior Law Program. We have the Laxon Legal Aid Center, Southern Nevada, Legal Services, so forth. So there are 5 or 6 across the state. If I have a case I want to refer or APS, then we send it to them. They identify the lawyer, and there's a variety of reasons for that because they're managing a large caseload and they can provide additional resources. My office doesn't have resources to provide to a pro bono lawyer. And so that's where I'm able to identify that it's the complex civil cases that we're not able to get the lawyers for because I work closely with them. And once we identified that gap, and I am actually submitting, I don't know how far it will go because of all the fiscal priorities, but my office on behalf of ADSD has submitted a request for funding for the complex civil litigation. So we would welcome anyone who would like to sponsor that. And this is not I don't think I'm supposed to say that because I'm not supposed to say anything political, but it's in the process. And so we'll be happy to send that to you. And I believe we would be looking for sponsorship. What we came up with a formula that for every $10,000, we believe we can recover $200,000 in fraud. Okay, and so it was a formula we worked out with the Senior Law Program based on the complex litigation that they've referred out so far. So I think it would be a great investment for the state because it does prevent homelessness and other dependency on the state if people can keep their hard-earned money. Thank you for the question.
Any further questions? Okay, thank you, Ms. Brennan. I also want to say thank you for your Latin lesson earlier today. I know being a graduate of Notre Dame, you're well versed in Latin, so thank you so much.
Thank you so much.
Okay, we'll move on to our next agenda item, which is agenda item 9, which will be a presentation on the prevalence of unhoused seniors, food insecurity, and a snapshot of the Supplemental Nutrition Assistance Program. Our presenters will be representatives of the Nevada Interagency on Homelessness to Housing, a Division of Social Services, DHS. You may begin when you're ready. Thank you.
Good afternoon, Chair and Committee. My name is Robert Thompson. I am the Administrator for the Division of Social Services, and I have with me today Deputy Administrator Kelly Cantrell. My apologies, we do not have a PowerPoint presentation. We'll be giving you a verbal report, but Chair, if you would like, after the meeting, we could put together our talking points in a memo form and submit them to the committee. Our primary purpose in the Division of Social Services is to be the safety net for Nevada. We oversee multiple programs. We oversee the SNAP program, which is also food stamps, TANF cash assistance, which also provides cash assistance to eligible grandparents that are raising their grandchildren. We do Medicaid eligibility, childcare, child support, energy assistance, and workforce development within our agency. Deputy Cantrell is our subject matter expert for the SNAP food stamp program. And in meeting in preparation for this presentation, we pulled the data, and we know that 1 in 6 Nevadans are struggling with food insecurity. Our agency processes over 500,000 food stamp applications per month for all Nevadans. I'm sorry, 500,000 per year. Destiny looked shocked, and you should be, Destiny. I'm sorry, it's 500,000 applications per year for the food stamp program. We do have seniors coming in applying for food stamps, and the main causes for food insecurity among seniors would not be a surprise. Seniors primarily have limited or fixed incomes, high medical expenses, they lack transportation, and suffer from social isolation. We service approximately 475,000 Nevadans per month. That one is accurate, Destiny. 475,000 Nevadans per month receive food stamp assistance. Of those, approximately 67,800 are seniors. So about 14% of our caseload is targeting seniors, and we define seniors as being aged 60 or above. There have been significant changes in the food stamp program this year under the H.R. 1, also known as the Big Beautiful Bill, that changed the food stamp program at its core. And we saw an expansion in the requirements for food, work requirements for anyone to receive food stamps. Before those changes last July, work requirements were set in our programs for individuals over aged 18 up through age 52. Those work requirements are now through age 64. So we will see Nevadans who are seniors being required to work 20 hours per week unless exempt to continue receiving food stamp benefits per the regulations of the federal government. We anticipate approximately 20,000 of the seniors who receive food stamp benefits will be impacted by this new rule. So it's slightly under 1/3 that could stop receiving food stamp benefits due to these new regulations. If the individual falls into what we call an able-bodied adult without a dependent that is required to be working those 20 hours per week, they would only be able to receive food stamps for 3 months every 3 years. So we will be working with community partners, and we will be providing outreach in an attempt to provide those, all Nevadans, but for this committee, the seniors, other resources such as resources to food banks. But because of those changes in the federal requirements, we may not be able to continue serving them for the food stamp program. There are in our food stamp program currently, it is income eligible. So we take a family's income or an individual's income, and we follow a very complex process from the federal government to determine how much a person can receive in food stamps. Of the seniors that are receiving food stamps, those 67,800 seniors receiving food stamps, over 10,000 of them are only eligible for the minimum benefit, which is $24 per month. And we think that is an important data point to bring up in committees such as this, because we've met with the federal government several times. We advocate, and one thing that we've constantly asked for is, could there be a possibility to change the food stamp program and the income limits for just the seniors? So the senior population that are living on these fixed incomes, who've paid their taxes, who are now possibly retired, could receive more than that $24 a month. So in these committee meetings, we do like to point that out. So if there are any advocacy groups that are wishing to target something, we've always felt, many of us have worked in this program for many years. I have worked in this program. I've just passed my 30 years since I started working as a caseworker in this division. And we've always seen this minimum limit come up over and over again. And we're meeting with elderly people who have gone through our processes, and we have to tell them, yes, you are eligible, but it's only $24 a month. It's discouraging for them. And we like to point that out. We don't set these income limits. The income limits are set by the federal government. The food stamp benefit is 100% funded by the food stamp government. Nevada legislatures are not in control of this. So if anybody did want to reach out, it would not be the Nevada legislatures to reach out to, it would be the federal delegations. There are some special provisions for seniors that do receive our SNAP program, provisions that allow us to take how much they are spending on their medical bills, for example, and reduce that from some of their income. So we do encourage our seniors who are applying for benefits to make sure that they disclose to us all of the medical bills that they are paying so we can give them the highest amount of food stamp benefit possible. Ms. Cantrell is going to go into some of our other programs. We have many programs in the food stamp in the social services division that are not necessarily targeting food insecurity, but if we can help every senior receive all the benefits possible, that frees up their other money to pay for food. So Kelly will go into some of those other programs and talk about our outreach programs.
Good evening, Chair and committee members. Kelly Cantrell for the record with the Division of Social Services. So like Administrator Thompson just said, one of the ways that we do reach our seniors is through our outreach program. It is the Targeted Outreach Partnership Program. And what it is our employees actually go out into the community and work at various community partner sites to provide our services at those various locations. And currently we have over 230 sites that we do this at. And some of the sites are specifically catered towards our senior community. So we're in places like health clinics, libraries, courts, community centers, but we are in 8 different senior centers or places that are specifically slotted for seniors. We also have 12 partners in the community that can actually take applications on our behalf and conduct the interview and gather paperwork so that when the application gets to my workers, all they have to do is make the eligibility determination and approve. And Helping Hand of Vegas Valley, who serves the senior community specifically, is one of those sources that can do that. But of course, if any senior walks into any of those partners, they can also apply through those entities as well as all of the folks that we have all throughout the whole state. The manager of the outreach program does do quarterly presentations to the senior centers to help the seniors be aware of available resources, the programs we have available, so that they're not in the dark, because it's hard. It's hard to get all the information you need sometimes. Mr. Thompson had mentioned the Energy Assistance Program. This is a program that will allow someone who's income eligible to receive payment towards their power bill or their gas bill for any heating or cooling costs. In the north, it's even the propane, the cost of propane. So it's for heating and cooling usage. And we have quite a few seniors who do take advantage of that program. And the idea there is if any money we can free up, because how many times have you heard, sometimes people have to choose, do I pay do I pay for food, or do I buy my prescriptions, or do I pay my utility bills? And so if we can cover some of those utility bills, it allows that money to be freed up so that it could be used towards the purchase of food. The MABID program, or the Medical Assistance for Aged, Blind, and Disabled, is another program that provides not only medical coverage, but it also provides a special service that covers the Medicare premium, the Medicare premium. And so right now that Medicare premium is $185 per month. But if someone is income eligible and they come in and apply for that benefit, it will pay that $185 so that that amount goes back into the check of the person and they get that part of their Social Security back, which, and again, like we said, could allow them to utilize some of that money for food if need be. It also can help, that particular program helps with deductibles, their medical deductibles. It can also help with copays when they go to the doctor. If the Medicare doesn't pay for all the services, it can help with the remaining balances for covered services. So there's various ways. One of the new programs that we have that just got approved last legislative session, thank you very much, is called the Kin Care Program. And while we do have TANF for individuals who are raising children who are not their own, maybe siblings or grandparents, Kin Care is a very specific program. Many children in the state of Nevada are placed with or voluntarily given to family members when the parents have substance use issues. And the Kin Care Program has been stood up to allow those family members to take advantage of a monetary payment. It's $430 per child, depending on income. If the child is income, it would be taken into account. But the maximum cash benefit is $430 per child. And for someone who may not want to apply for traditional TANF due to child support cooperation or a myriad of other reasons, who may not want to or cannot pursue foster care payments, that is another avenue that they can utilize to try and get assistance for children that they're raising that they didn't give birth to. So that is an amazing program. We just stood that up effective March 1st. We have taken a total of 3 applications. We were able to approve 2. One was over income, and we're super proud of that. So we really want to get the word out there about that particular program. There's a lot of grandparents raising babies today. We all know that. And so I'm going to go ahead and stop here and let Administrator Thompson cover the next section.
So we were also asked to speak about homelessness targeting seniors, but I do want to just present that the Division of Social Services does not have a homelessness program. We are not a housing agency. We coordinate the interagency council of homelessness to housing for all of Nevada to bring everybody together to talk about the problems and coordinate services between the government agencies to help break down silos, but we do not have a program within our agency to provide the assistance. That assistance is done through HUD, but we did pull some data to be able to present to this committee. And according to the recent report by HUD Continuum of Care Homeless Assistance Program, there are 41,292 seniors aged 64 or older that lack traditional fixed housing in Nevada. Additionally, there are roughly 101,000 individuals aged 55 to 64 and 32,800 veterans who also lack fixed housing. Again, while we do not have a housing program, we do we provide administrative support for the interagency council. And if there are any concerns or questions that we'd like us to take back to the council, we can pull that. We can have specific data pulled and report back to the committee. And we're open for any questions.
Thank you for the presentation. Committee members, are there any questions? Yeah, I had a brief question. I know you mentioned this is the one that I think got our committee secretary here, our policy analyst, taken aback. But you said there's about 500,000 applicants for assistance on an annual basis, correct? And out of those 500,000, how many actually do succeed in receiving the assistance?
So that's specific to our food stamp program only. The food stamp program receives approximately 500,000 applications per year in Nevada. We currently have approximately 250,000 households receiving assistance and 475,000 individuals that have been approved. Usually food stamps are approved for 6 months at one time. We are able to approve seniors for 1 year at a time. So the approval rate, I believe, is approximately 80%. Kelly's whispering to me. So it's 20% are denied, 80% are approved.
Thank you. And please, Administrator, if you can send those talking points over to the committee, it would be greatly helpful in taking in all of this information. Thank you for your presentation. I believe there's no questions from the committee, and we will move on to agenda item 10, which will be our last but not least presentation this evening. And this will be an overview of food insecurity in Nevada for the senior population. And I believe our presentation will come from 3 Square and the Food Bank of Northern Nevada. Thank you. You may begin when you're ready.
Right. Thank you, Mr. Chairman and committee. All right, we are rocking and rolling. All right, many of you, my name is Lisa Segler. I'm with 3 Square Food Bank. Many of you know about the work that 3 Square does. I'm just going to do a high-level overview. Our mission is to provide wholesome food to hungry people while passionately pursuing a hunger-free community. And probably worth noting that since we've opened, we just turned 18, we're officially an adult. We have distributed more than 644 million pounds of food into the community. This data is a little bit old. It's the best data reporting system that Feeding America, our parent company, a national company, has. But 1 in 6 other Nevadans is food insecure, and 1 in 5 children are also food insecure. And we know now that the need is much worse. We just don't have data that is reported in the same way to reflect that, but do know that the need has significantly increased. And we also know that food insecure neighbors miss an average of 6.3 meals per week. We service the lower southern 4 counties in Nevada, and there's currently about 377,000 folks that are food insecure, and again, that number is lagging. This is just a highlight the 4 counties that we serve with some demographic information. Probably the most important thing to note here is rural populations. While they are smaller, they are definitely in need. Their food insecure rates are between almost 14 and 22%. Last year, we distributed about 48 million pounds of food. And worth noting here is during the shutdown at the end of last calendar year, we distributed an additional 12 million pounds in that short amount of time. So our numbers will definitely increase for this total year, but I just want to show on average, it's about 48 million pounds of food that we distribute every year. One thing here probably worth noting is that we have wonderful community partners. We work with over 150 community partners, but the difference between a food pantry and a food bank is worth discussing for just one moment. We are the only food bank in Southern Nevada. There are only 2 food banks in the state of Nevada, and we are, think of us like a giant Costco. We bring in all the food, we have big warehouses, and we have a huge fleet, and we get that food back out to the partners. Those 150 partners I mentioned, those are food pantries. So I know sometimes those words are used interchangeably, but they are actually 2 very distinct and different things. And then we offer several programs at 3 Square. Our benefit services outreach team, we have a robust call center that also has a in-community arm of what the work that they do. They're advocates out in the community that help folks register for benefits. And we have robust children nutrition programs. We do at-risk after-school programs, as well as summer programs. And then we also have our Backpack for Kids program, which is on the weekends. I'm going to talk mostly about senior hunger programs for today. Golden Groceries has been a wonderful program. I've had the honor and privilege of standing these programs up about 8 years ago when I came to 3 Square, and it's a supplemental program that serves about 11,500 seniors per month, and it's some supplemental groceries. There's lean proteins, whole grains, a bag of fresh produce that comes along with that program. We have over 30 locations, and some of them are within traditional pantries, and this is a smaller area or section that the Golden Groceries program would reside in. Senior community meals, this has been a really successful program that we partner with the Clark County Library System, and they are free hot meals for seniors. They're offered 5 days a week at different locations. We are really proud of this program. The donor that's associated with the senior funding said to us that it has to be more than food. And so this is our one program that we had an opportunity, because we actually service the meal ourselves and deliver hot food every day. That the seniors are starting to become, or not starting, the program's been operating for about 2 years, but they are friends now. They carpool from meal to meal together on different days of the week. And we joke and call ourselves matchmakers now, because some of them have started dating even. And so we are very proud of that, actually. But we know that the senior suicide rates in Nevada we are usually remain in the top 5 in the nation. And so we understand how important isolation work is. And so again, why we're so proud, and we offer programming every day as well as that free meal. DoorDash has been an excellent partner to us. We do on an ongoing basis about 4,000 home deliveries a month to seniors. And through the government shutdown, we had added an additional 9,000 on top of that in a very short period of time. We also partner with Lyft. Seniors do not need smartphones or a cell phone at all. We actually have all of Lyft's programming and their software on the back end that we're able to schedule those rides up to 7 days in advance. And so we offer free rides for seniors to pantries, to the community meal, and then depending on funding, we've offered rides to COVID vaccines and all sorts of things. We also offer bus passes. This is a little bit more information on that benefit services outreach team I was talking about, where we help enroll folks into SNAP and all sorts of health insurance assistance programs. But really, we are kind of try to be a one-stop shop for anybody in the community who calls us on usually one of the worst days of their life, and see what we can do to make their situation a little bit better. Policy recommendations, we really are interested in looking at supporting children's nutrition, continuing while we don't administer the school lunch program, but we are big advocates of that program, expanding access to food for all, and then strengthening program security. And that's all the presentation I have, but I'll take questions.
Thank you. Can we actually go to Carson City and have complete our presentation from the Northern Nevada Food Bank, and then take questions together, if that's okay? Okay, thank you.
Good afternoon, committee. My name is Shane Piccinini, and I'm with the Food Bank of Northern Nevada. And I will run through this really quick. Lisa graciously covered some of the same material I have, so hopefully we can keep this short. So the Food Bank of Northern Nevada has around 140 partner agencies, and we have been in service for more than 40 years. We have distributed in 2025 roughly 23.1 million meals to our neighbors. This slide right here kind of describes who is food insecure, but as you can see, I think Administrator Thompson said the number is now 1 in 6 people in Nevada are facing hunger, with 1 in 5 of those being children. This is the service area in which we operate. We've got 90,000 square miles, which is bigger than almost all of the states. And we do operate in 8 of 10 of the Sierra California counties. This right here is a chart of some of the food insecurity rates in Northern Nevada. I won't go through all of them, but as you can tell, like what Lisa said, that, you know, in the rural counties, a lot of those food insecurity rates are hovering, you know, between 10 and 14%. And then we just have distributed pretty close to 27 million pounds in 2025. And that works out to just under 24 million meals. And the need of the people that we're serving, going back to pre-pandemic and 2019 to, you know, fiscal year 25, has just been consistently going up. So, and then this right here is just a chart of the meals that have been provided by county for your reference later. So we also offer a number of programs that serve seniors. We also have a Golden Groceries program. which served 3,719 seniors age 60 and over, which is about 65% of the overall percentage of the program that is served in 2025. We have a mobile harvest program that served just under 8,000 of our neighbors aged 60 and over, and that was about 23%. We have got CSFP, which is now known as the Senior Nutrition and Wellness Program, which is also operated through the Nevada Department of Agriculture and the USDA, and we're distributing about 2,500 boxes to the seniors there. We've got a mobile market called Produce on Wheels that offers fresh produce, fresh fruits and vegetables directly to senior communities at no charge. And we're serving just over 4,000 people in that program. And then we have a prescription pantry program that partners with healthcare providers to give eligible patients basically a prescription for healthy food to help manage chronic conditions like diabetes and heart disease, because we know that food is medicine, and access to healthy foods, low salt foods, low sugar foods, low fat foods, all of the good food, I'm kidding, really does help improve health outcomes. And then we do have a school pantry that serves about 2,100 neighbors. And it's important to remember with the school pantry program that there are quite a few adult caregivers over the age of 60 who are caring for kids that are school age. And so this is just another way for us to help reach that population. Robert and Kelly covered that for us. They also covered the changes in HR1, but I do want to say that one change they did not talk about when it comes to the changes to the SNAP program and the safety net is that the Thrifty Food Plan will no longer be updated on a normal schedule. It was before HR1, it was going to be reviewed every 5 years. The Thrifty Food Plan is critical because it sets the monthly benefits for SNAP based on the rate of inflation. And then also there's going to be a pretty significant cost shift to the states that are operating the SNAP program through administrative and through an error rate penalty. Our legislative priorities for 2026, the first and foremost is to make SNAP as resilient and efficient as possible. And to answer Administrator Thompson's call, we are in fact doing what we can to ensure that seniors have got better access to SNAP and to increase the monthly allotment for SNAP recipients that are considered seniors. TFAP commodities, we're asking collectively the Feeding America Network, for which 3 Square and the Food Bank of Northern Nevada are members of, are asking for an additional $472 million to support the TFAP commodity purchase so that we have got ready foods available to meet the increased need that both of our food banks are seeing. With the Older American Act and nutrition programs, Feeding America and our food banks are asking to provide $1.6 billion. This is mainly to help us provide support to home-delivered meals and congregate meals, which many of our seniors rely on these programs. And then the last part of that is just to ensure that the food distribution for Indian reservations continues to be strong and robust. So we're asking for $342 million for food purchases through administrative costs. And I do want to put one thing on the record. All of these are our federal policy asks. We are not asking the state legislature for this money, but it's important to understand that because these are USDA operated programs, that we will need the legislator support in order to get to these goals. And with that, I would be happy to answer any questions as well.
Thank you. Committee members, are there any questions for both our food banks who are present here with us today? Yes, Senator Cruz Crawford.
Thank you, Chair. I told myself I wasn't going to ask too many questions today because I know, the information was already given so great. But I just want to let you know that I appreciate all the work that you do with the schools. We do have an increasing number of grandparents and great grandparents that are supporting kids later in life. And so we do take advantage of the 3 Square fresh fruits and vegetables. And I'm sure in Northern Nevada, we would be using yours as well, but it's a long way from Northern Nevada to come to CC in East Las Vegas. But I do see that the seniors are using the food pantry resources more than the parent, the direct parents. I don't know the proper words for that, but so thank you for that work. I appreciate it.
Thank you for saying that.
Assemblymember Karras.
Thank you both for your presentations. Thank you, Chair. I did not catch if Northern Nevada is doing the rotating community meals, hot meals, but for Southern Nevada, I would like to know, is it on your website where these are taking place so that any seniors watching the committee? Sorry, I turned my mic off. Just to make sure we can spread the word, because I think that's a great way for them to socialize as well as help them with cooking that they're probably not doing frequently enough with healthy food. Thank you.
That information is on our website as well as our social media channels, and we actually produce a month ahead of time. So anyone could go on there and see what is being served the entire month. And one thing that's probably worth noting too is that meal is free for people who are 60 and better, as we like to say, but their loved ones. So if you want to bring grandchildren or a younger spouse or a friend or a neighbor to that meal, just one person in the party has to be 60 and better.
Thank you. That's a wonderful program. Both of you have done astounding things for your areas. Thank you, Chair.
Any further questions, committee members? Yeah, I had one question in closing here. There was a great program. I'm very familiar with the one that 3 Square used to administer back in the day. This is, I think, 2018-19. This was a senior veterans hunger program. In I think a coordination with some of our veterans halls, the VFW, the American Legion. I remember I volunteered, for that program many times. So I was wondering what happened there. I know that the program is not in place anymore. Was there a grant issue or was it folded into another program? So if you could just please comment on that. Thank you.
Definitely. I was there when that meal, I remember you actually coming. So thank you. The meal, we had a little bit of some leadership challenges there, and then they actually ended up selling that building. And so, and COVID was a part of that too. And so that is really why that meal stopped, but that's what allowed us to open the meal at the library. So we just kind of transferred the program and the system somewhere else, but that program was near and dear to my heart as well. So I was sad to see it go.
Any further questions? Awesome. Thank you. Thank you so much for your presentations. We had a bifurcated presentation here, Northern and Southern Nevada. And again, thank you for all the great work that you do in addressing food insecurity in our state. We're going to skip over agenda item 11. We're going to be discussing that internally as a committee for our future topics for our future meetings. And we will now go on to a public comment, which is agenda item 12, and our final agenda item. As a reminder, we ask that public comment be kept to 2 minutes so everyone interested in speaking can be accommodated. A person may also submit public comments in writing, either in addition to testifying or in lieu thereof. Written public comment may be submitted before, during, or 48 hours after the meeting adjourns. Is there anyone in Las Vegas who wishes to provide public comment?
Good afternoon or good evening. I'm Jenny Roth. I live here in Las Vegas. I'm wearing purple, so I'm going to give you 3 guesses of what I'm going to talk about, and the first 2 don't count. I went through the Alzheimer's journey with both my parents. Back in 2015 or 2014, I lost my mom. 2018, I lost my dad. I have 6 siblings, and I am the second youngest, and I ain't young. So we're kind of staring down the barrel of possibly seeing another sibling going through this journey. The reason I mention that is because when I look back on that journey that we went through, that was 8 years ago when I lost my dad. And some things haven't changed a whole lot. Some things have, as Tori mentioned, we're finding early testing. We've got some treatments. We don't have a cure. But what we don't have is the ability to help people through this journey because they will die from this disease. And the people that have to support them, sometimes they're falling into a sandwich generation where they're taking care of kids themselves and now they're taking care of their parents and they don't know where to turn. And so they're grasping and looking for help. So that's why I'm advocating for the State Services Coordinator for Dementia, because I really think pulling those resources together and giving people that direction when they're dealing with this is just a godsend. We went through it ourselves and we know what that journey is like, and it's still hard. So that's what I would advocate for, and hopefully we can get, join the other 32 states and have that coordinator here. Thank you.
Seeing no more in Las Vegas, is there anyone in Carson City who wishes to provide public comment? Okay, not seeing anybody making the mad dash there to the desk. AVH, is there anyone waiting to make public comment?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Okay, thank you, broadcast. This concludes our meeting for today. Our next meeting is scheduled for Monday, April 20th, 2026, beginning at 3:30 p.m. We are adjourned.